Hi, my name is Lori Burtok, and I've been with Shield Healthcare for over 20 years, and in those 20 years I've learned quite a bit about incontinence from caregivers as well as healthcare professionals. So today I'd like to share some tips with you and empower you to live well with incontinence. I want to remind everybody that incontinence can be caused by a disease factor. It is not caused by old age. So be sure to tell your healthcare professional or your doctor if you're experiencing any form of incontinence. In fact, it's important that you tell your doctor because he may be able to mitigate or eliminate your incontinence by surgery, medication, physical therapy, possibly Botox injections, and laser treatments. Take a look at what you drink during the day. If you're drinking a lot of coffee, tea, eating spicy food, and alcohol, those irritate the bladder. So your incontinence will be irritated by that. Even chocolate, because of the caffeine, can sometimes be an issue. Eating a lot of spicy food is also irritating. So try to cut back on those things. Now, does that mean you should stop drinking water? Absolutely not. You want to drink plenty of water because the water needs to flush through the bladder to keep the bladder functioning normally. Without enough water, you actually can cause the opposite problem and end up with a urinary tract infection. So you don't want that. So drink a lot of water. And also, if you're looking for other things that are good for the bladder, cranberry juice is good, as well as lemonade. Another tip to help control your incontinence is to lose weight. Additional weight on the bladder puts a lot of pressure on it, and it loosens the pelvic floor. So whether you're pregnant and then you eventually lose weight, the pelvic floor has obviously been weakened to a degree, and the same thing happens with people who are obese. So I highly suggest losing weight. Did you know there are exercises you can do to improve incontinence? There's an exercise called a kegel. I'm going to explain to you what kegels are. Kegels are a pelvic floor exercise where you squeeze the pelvic floor and you release it. It's just a gentle squeeze and release. Now, if you're wondering where that muscle is, you find it when you're using the restroom and you have a flow of urine coming down and you stop in the middle. That squeezing that you're doing is the muscle that we're talking about. So what you want to do on a daily basis is do those kegels about 50 times a day to increase the strength of that muscle, and that will help you control your bladder. If you can't figure out how to do that exercise, please check with your doctor or your healthcare provider. Okay, let's talk about a common problem, leakage. So I'm going to talk about what you need to do to diagnose the situation. First of all, if you're using pads or a pull-up, it might be time to graduate to a full brief. A full brief will hold 1,800 mLs of liquid. That's a full void. So if you're going to go into this product, the next thing you want to check is that you have the right size. If you don't size it correctly, it will not work. Here's an example based on height and weight of the size that you should consider. And you can find a link to this chart below the video. Remember, if you think that a larger size is going to absorb more, consider that the gathers around the leg here, and notice they have the elastic gathers. When you put that around the leg, it's going to be way too loose. So now I'm going to have hangage here, where the urine is going to run right down your leg. That will cause definite leakage. So make sure you have the right size. Once you do have the right size and you still experience some leakage, you may be voiding more than once into the brief, and these aren't really designed for that. So then you may want to consider putting a booster inside the brief, especially at night. So these are boosters. These boosters have no plastic on the back. They do have an adhesive to hold it in place, and they're pretty thick, okay? This one's a little thinner, but remember, these have polymer, which absorb quite a bit. So you would place this inside of the brief and then put the brief on as you normally would. Keep in mind, it's going to weigh a lot when you take it off with that extra absorbency. If you're a caregiver and you'd like instructions on how to change your loved one's brief, we have a full video on that. You'll find it in the link below. Are you embarrassed about being incontinent? No, you shouldn't be, because nowadays we are all living longer, and as we live longer, sometimes these complications come up. And it's totally acceptable to talk to your friends or family about it, and especially your healthcare provider. Did you know that UTIs are very common with incontinent patients? especially if they're bedridden. What is a UTI? A UTI is a urinary tract infection, meaning that the bladder is now irritated and there's bacteria that's entered. How does that happen? Well, first of all, if your loved one is not drinking enough water, they're susceptible to getting a UTI because the urine may become super concentrated and it's not being flushed out on a regular basis. If you notice dark yellow urine, that means there's a possibility there's a UTI. Another way is through cleanliness. If the patient is having any contamination of feces into the urinary tract, that too will cause a UTI. How do you solve a UTI? You want to contact your doctor and healthcare professional. Most of the time, antibiotics are required. If you have further questions, check out our incontinence community on our website. Also, you can order our free Living Well with Incontinence booklet for further information. Thank you for watching. Stay tuned for more videos from Shield Healthcare.